the provocation alleviation test, trying to decipher if it's intercapsular or if it's musculature or something. So just taking like a passive hold and seeing if that relieves, if they're in that point of pain. If a passive hold takes away the pain, then
Like if they're in that range of motion?
yeah,
between
wherever their
60 and
painful
120,
range is,
yeah.
and if that could make you think it's more musculature than.
Right.
But and then like compression and traction and those things are telling like, is this something that's bony that's hurting, or is it getting relief from traction? Where if there's a tear, it might feel worse pulling away from it.
Yeah, that's good.
That is
I have
interesting.
done that before, like getting them to go actively, then I'll support it and just trying to get them relaxed, and like, oh, it feels much better.
Yeah, that makes me think like rotator cuff right away.
Yeah, for sure.
I remember studying just like as far as like bursitis versus tendonitis versus a nerve injury, like they all have the different components. Like I think like if I remember correctly, tendonitis is like when you manual muscle test them, they're gonna be like weak and painful. But a bursitis, I think they're strong and painful. And then like a nerve injury, they're weak and painless. And like going on like whether they're strong or weak versus painful, painless, and that's how you can also differentiate some of the various
Yeah.
degrees.
Because
of-
unless they have associated rotator,
Yeah.
like that's also inflamed, a bursitis shouldn't cause muscle pain
Yeah.
or like.
But do you think people would get, just structurally speaking, would they get a bursitis without any kind of supraspinatus? Tendon, inflammation?
Yeah, that whole like thought line I've thought about a lot of
Yeah.
like, to me bursitis is associated with something
Yeah.
else
Oh,
because
yeah.
you've had some area that's already inflamed in the area rather than
Right,
just
and-
like,
and that-
ooh,
that
suddenly
rubbing.
your bursa's mad at you, you know.
Right.
And, I think with all of it, the goal will be the same though, just to get them here, and just opening up that space as much best as you can, trying to loosen up if it's posterior capsule tightness or inferior capsule tightness. Just trying to create as much space and passive range of motion, just trying to calming things down. But I've even done some, even starting with some isometrics and just getting some good contraction going in the area. But I always think about, when I think about impingement, I always think about create the environment for it to heal. So what does it take? What's going on? Everything is kind of closed in, forward, probably reduce blood flow, so on and so forth. Then just try to reverse that, figure out what's going on in this scenario, then just try to reverse it, open up the space. Pec minor is probably tight, just all of those things.
Yeah. The other day I was using your lacrosse ball for pec minor release on some of my patients.
What was it?
Your lacrosse ball. I had
Oh.
to do like a pec minor release in the doorway.
Yeah.
But, because they're like, a lot of people are very, very sensitive when I do it with my hands.
Yeah.
And I'd rather them just work it out themselves. But, I think the biggest thing that I found challenging is like getting that anterior musculature to open up without having that, either anticipatory pain or that kind of apprehension pain of being in whatever position that you need to open up the pecs, A
Like
lot of
for
people with
pec
shoulder
minor?
stuff can't do the door, like they hurt with the doorway stretch or just doing it on the foam roller and they're like, this is the same motion that hurts my shoulder,
Yeah.
but it also feels like a big stretch on the front. But,
And Jamie, you just made me think about a good manual pec minor. Are you familiar with the pec minor stretch when you inferior gliding the scapula and you pretty much upwardly rotating the scap?
no, but definitely show us
This,
how.
this is a good one. Lay on your back for a minute if I can use it.
On my back, sure.
And just, you can slide over towards me. And a lot of times, so assessing the pec minor, to see if it's even tight, I'll just give them I'm just getting them put both hands at their side and I'll just look at them.
See how far it's off the table.
To be honest, your right side does look a little tight. Kind of sore. You have any shoulder problems?
Every once in a while.
Which side?
Right.
So, and you can even, just looking at her
Yeah,
posture, you can tell it's hiked up a little bit. Even, that's a little higher. So in this case, so you can rest your hand on your belly, just roll just a little bit that way. And it's easier when you can go under someone's shirt and get on their skin is definitely easy because the clothes are gonna slide a little bit. But I'm right on her scalp. I just try to slide over just towards it just a little bit. I try to pull her. You can roll a little more. Pulling her scalp down pretty good. Roll over on my hand, and then I'm just gonna rotate the scalp. So if you think about it, this is the. If you got the, I wish you. Would you mind bringing the skeleton over?
Yeah.
So if the pec minor is tight and the pec minor downwardly rotates, and in the case that it's tight, it's pulling it forward. The inferior angle is coming up. That is tilted forward. You just pretty much tilted it back.
Yeah.
When you tilt it back, it's gonna stretch out the pec minor.
Yeah, the biggest one, the only one we learned in school was climbing on the table and doing like the cross arm, and I mean, never found that appropriate to do, actually.
I mean, I learned one where you kind of stabilize along ribs, is it 3, 4, 5?
Mm-hmm.
That it attaches to, but that gets really kind of uncomfortable, especially like with a female patient, you know, and then pushing it back. And I have had some success with that one, but again, it is a little bit awkward
Yeah.
to have to stick your hand down there.
I think this one is good for male or female, and then it's
Yeah.
because if it is, let me see, pec minor is here, right? So it goes.
Core
Is it
process.
core? Yeah.
Yeah.
Core
Yeah.
process and 1, 2, 3. So 3, 4, and 5. This is off a little bit, but yeah. So I'm just here, and then just rotating it back and opening up space.
Yeah.
So that I mean the ribs are not coming up too much, and that's definitely gonna open up the pec minor. So that's a pretty good stretch. So that's another thing. Impingement wise, I'm looking at posterior capsule, the musculature posterior shoulder, and I'm trying to free up the pec minor. Just to create that space. I'll tell you one mobilization that I wish I would have known years ago, because I've had some patients, shoulder patients, rotated cuff. It was two that I can think of. As they were recovering after a surgery, they got better, but their range of motion just got to a place it was stuck. And have you ever seen that patient that didn't really, they kind of moved in that scaption plane going up, they didn't have that. And I just was totally stunned on like why I couldn't improve those patients, but I never did the prone Faber mobilization. Do you guys ever go to that when you're doing shoulder?
No.
No.
And then when I started,
Just keep dropping these on us.
Yeah.
These are awesome.
when I started to do it, I mean it totally changed on the patient that it was appropriate for.
Yeah.
It totally changed everything. It
I
freed
have
their range of motion.
someone right now who's doing that, and I also can't get her past like 165 at least active range of motion against gravity.
So this might be a good one.
Yeah.
I mean, is she pretty?
Her pain levels are going down right now.
Okay.
So,
So it's a good one. Would you mind being patient?
no, I don't mind.
So you
What
can
we're
just
doing.
just go prone,
All right.
and then let's practice some of this stuff. Bring your arm. Now you can stay over,
Okay.
but just bring your arm almost like you're in a sleeping position. So you just kind of get that Faber position, flexion, abduction, external rotation. And if they have pain there, I would just tell them, okay, let's bring the elbow down just a little bit. But if they're fine there, a lot of times I would start here and I'll progress it all the way up to the pain free.
Okay.
But I'll do a skin lock and just going straight down. Sometimes I have some support there, a towel or a pillow or something. Because sometimes literally if they're very tight, I'm gonna lift your arm just a little bit. If they're very tight, they would be almost like this. It would be a lot
Like
of
this?
space. Yeah, they wouldn't even be able to. Their chest would be pretty far away.
Yeah.
And so what are you stretching now? Is it more like anterior structures or inferior?
Kind of anterior,
More
inferior.
inferior, huh? Because that's
Yep, a little both of them.
And what's the point of your mobilization anteriorly?
So it's just freeing up the capsule altogether.
Okay.
One thing I've learned from just manual therapy in general it's that a lot of times we were taught in school, you know, the kind of orthokinematics and the concave, convex
Yeah.
rule.
Yeah.
But really, when you start to mobilize a joint, especially the shoulder, if you can just get any type of stretching in any direction, it's gonna improve the mobility some. So this, for me, has improved flexion. You know, it has improved abduction. It just really depends. So I think it's just one of those areas that's neglected. One of the capsule areas that's neglected with mobilization. What does that feel like, man?
Well,
What's your line, just like anterior, posterior?
I change it up.
Okay.
Sometimes I go more here. And I
A
get a
similar
feel.
thing you're saying, just
Yeah.
get movement in the whole
Yeah,
for,
body.
exactly.
for me, I feel it more that way.
You feeling whatever?
Yeah, than just straight PA, I feel it.
So that means she's not
Yeah,
tight there at
I'm
all.
not tight there at all.
When I come here, I come
Yeah,
to a
I
little
feel-
resistance.
I feel it there.
Yeah, so you can play around with it. I mean, just kind of feeling for whatever the
Some-
tightness is.
Some inferior resistance would say you could have limited flexion too, right?
Mm-hmm.
Yeah.
Yep, and definitely abduction.
Yeah.
But I think if you got tightness in the capsule at all, it's gonna impact your
Right.
range when you're
With
going.
flexion, I mean, you have that rotation. It's
Yeah.
a spin orthokinetically.
Yeah.
So you really need all of your, all directions of your capsule
Yep.
to be mobile.
All right, you guys want to try the last two?
Yeah.
The favorite. We got, it's time. All right, we can we can do it real quick.
All right. You wanna try it? You wanna try it?
Yeah, if I can find you.
Yeah, you got better house too.
So,
Well, I actually have like my hands under my chin.
okay. So you're doing more like here.
Wish I had more time. We could actually.
But you said you felt it more.
Yeah, and
Was
he was
pushing,
actually
like, from
close,
this direction?
his hand
Uncomfortable?
placement was
Yeah, it's
actually
comfortable.
closer to the joint line.
Okay.
Yeah, the guy that I,
Kind of diagonal.
What guy is
See
this?
him
Still
tomorrow.
straight down.
Patrick, he's in here for a long time. He's in here for his knee and his shoulder.
Tattoo guy?
Mm-hmm.
A little bit
Young guy drive the
slower.
F-150?
He drives a
Right.
Oh, that guy. I know who you're thinking of.
The guy that with the track shoes on.
Yeah, yeah, yeah.
Good.
So it's
He's actually right
That
now
was
in
good.
his drive
Okay.
seat.
Skin lock, Jamie. So
And
so
then-
grab the
I don't
skin and
remember what
take
the other
it
one was.
that way, and then so you
Oh,
lock
that
the
was
skin
the-
out,
it
and
was
then you
the
all joints on
posterior.
there, or you can
Yeah,
save a
the
little
stretch.
more.
Heck,
And you can still use
Yeah,
both
exactly.
hands with it. You just wanna take up the slack pretty much.
Can you
See it?
roll?
Roll.
I feel like going straight down is easier.
There.
Mm-hmm. Now, if you do what you just did, go in that direction,
Mhm.
I would just make sure
Yeah,
that
Where was your hand?
I think my hand
Your hand,
was
okay.
there.
elbows locked and having your body in a good position.
Yeah.
So I would just move
Bring this
the.
forward.
I feel like I'm limiting
Yeah, I
you
feel
because
Because
like
I use
Like
my
where
body
my
weight on
hand
this.
is.
I have to.
Maybe
Some
my
people are
hand
very
was-
stiff. You
where
just
was
gotta
my
lean
arm?
into it.
I would-
I
You
don't
just
know.
gotta kind of feel it out so
L?
the patient is not as irritable if it's not that painful.
Yeah.
If they're not feeling anything, go for it.
Maybe it was a
Yeah, I
quick
would-
They're usually
chest.
stiff though, coming out of it.
And then
I
So-
felt
lock
more
here
of a
and then
stop
you
going
pull.
this way than straight
Yeah.
down.
And then-
Do you mind doing it on me?
And then there's a curl
Okay.
band.
I learn best when I can like try to replicate
Cause
what
it
I-
was,
I
I
don't know why I
mean,
keep popping
I
out.
guess you pull, stabilize scapula and then pull kind of, I guess, rotate over coracoid process. No.
Some concept. Chris, with the pec minor stretch, where was the patient's arm?
Yeah, I just have it kind of resting on the belly.
Okay.
On the belly, okay.
So then you're
Ah,
here,
okay.
okay. So you're here, rotated, and then you want to push them more,
So you would come from,
like coracoid process and push. Are you pushing back? Because I feel like I'm almost pushing, limiting them with my hand where
which
Where's
one
the
hand?
position?
Which hand?
my left
Bottom
hand.
Yeah, so you wouldn't come from here, you would come from here and pull it down.
Oh, it's
Oh,
hot.
that's
So
what it
it's
is.
really
Okay,
depression.
right. I was. There we go.
Do you mind seeing this on my right side?
Kind of push more. No, that still feels
Oh.
weird to me.
I might have to roll over more, gotta really place your hand.
That's uncomfortable.
No, I just feel it on more, so
Hey there,
I
hey
know.
there.
what the feel
I'm
would be.
there, like I'm
Time
in
more?
Yeah.
fossa and able to pull back. This table is too low for me.
It's not sore?
And then,
Wow.
I mean,
Um,
we're rotating.
it's a
I'm
little sore.
trying to push.
Yeah, so.
Is that any better? Being able to rotate back and
Yeah,
forth?
yeah.
Okay, so that's what it is. So I think you're trying to do like a,
Yeah, I felt nothing on the left side.
I guess like
Kinda like do
like a
posterior
posterior tilt of the
Yeah.
scapula with the left, and then kind of do push on more the forefoot process.
Can you tolerate it?
And shoulder kind of up, so it's like you're almost rotating that way.
For some people, like they're very irritable. I can't even
I assume.
like Bo, the guy that
I don't know. I'm my
he's so guarded.
my
I think so,
shoulder.
too.
Every time I do it, so I have to kind of
Would you mind
slowly,
laying?
Yes.
over a period of time, work into it.
Prone.
You see anybody?
He's my patient.
Oh, okay. Just wanted to make sure, because I've got eval. So I don't know.
Go ahead. There you go. We're doing a skin lock here.
Mhm.
How does that feel?
Good. I mean, I have consistently tight pec and all of that stuff, so.
Yeah, so that one I kind of felt like right in here. So to me, it was like inferior spine.
Yeah. Yeah, more of like, it really is like everything around my shoulder is always consistently tight. Pecs, inferior, scapula, posterior, like I feel like all of it is just.
Are we getting our people or?
Is he okay. Thank you.
All right, thank you.
Okay, thank you. And we can